Hello, my name is Ivana Dostalova and I am Czech-based neuroscientist and photographer with 10-year experience in clinical science and 9-year experience as a professional photographer. At first, I would like to thank for this opportunity to talk here about my work and for the great experience with Neil Gibson's postgraduate certificate therapeutic photography. Thank you. I would like to briefly introduce you with the holistic methodology I have been developing and which uses photography and objectification of visual perception as one of the pillars how to work with brain neuroplasticity. In other words, how can the right images that we let come into our minds, that we systematically pay attention to, change our minds, our brains for the better. So let's get to know the seed that was seated. It is now proven that the brain can change itself continuously during the whole lifetime. This is brain neuroplasticity, which can occur in three ways. The first one is chemical signaling, the second one is by altering its structure, and the third one are functional changes. There is no neuroplasticity drug you can take. Brain neuroplasticity depends on the individual's behavior. In other words, training of new perceptions and behaviors leads to redirection, closing of the old neural pathways and creating, opening, beginning of the new ones. That means that behaviors that you employ in your everyday life are very important. Each of them is changing your brain. What is also interesting is that the ability of brain to change differs from individual to individual, and the term personalized medicine has arisen recently. The question for us here is what is the role of the photographs, visual pictures in this process, in the process of brain neuroplasticity? Sight is dominant sense, which significantly determines how we see and perceive ourselves in relation to others, ourselves in relation to the world and the world around. Photographs can represent and can be seen as a current capture of our mental image, representing its objectification through which we can perceive our mental image and to systematically work with it and thus learn. And that's the point where my universe methodology works with photographs. It uses it as visual objectification that can help in the process of brain relearning. At first, it is needed to be said that my universe methodology is not a therapy and does not use photographs as a part of therapeutic process. MOM is being developed as a kind of lifestyle medicine, life self-approach, which main goal is to lead to sustainable well-being and activation of self-healing process. MOM uses the combination of already known field of therapeutic photography and other photographic approaches, which I have learned during the journey of the photographer, and mainly photography evoked self-other relations mindfulness, PSORM, working with step-by-step tasks and facilitated visual photographic diaries in combination with other aspects, which is my own kind of using photography and will be defined a step later. MOM works with sight and seeing, with visual mindfulness, art of seeing and true perception, and defined walking and visual meditation to bring the brain through the waves which connect conscious and unconscious, these are alpha waves, to unconscious to the slowest delta waves. MOM will be delivered via defined programs from 10 to 20 weeks in duration and will be specifically discussed later on. Here, I would like to define photography evoked self-other relations mindfulness. PSORM is a methodical approach using photography, specific combination of photographic practices and therapeutic potential of photography for the objectification of mental image in connection with work with the principle of art of seeing and true perception through precisely defined step-by-step tasks working with brain neuroplasticity. The approach is based on proven neurobiological knowledge and uses defined visual mindfulness in the present moment and induced conscious imagination in the combination with photography and visual objectification to self-grow, self-awareness, self-knowledge, self-acceptance, self-kindness, and improving of relationship with ourselves, others, and everything around us, and with what we have been through and our brain stored it in unconsciousness, leading to retranscription, relearning, and a happier and more joyful perception and experience of subjective reality and mental image. Here we have main pillars of my universe methodology clearly displayed. These are visual mindfulness, visual and walking meditation, neuroscience, Eastern philosophies, and photography. These pillars are combined purposefully and step by step and specifically to a certain group. The whole system is protected by WOFRE approach, which I developed in its basis form during my photographic journey as a kind of safe and supportive relationship between the photographer and the photographed person, initially used for the photographic process itself, but later on it was meaningfully widened to a relationship between the facilitator of my universe methodology and the client. WOFRE is a kind of safe space when during all the processes we use in my universe methodology we approach the client with humanity and humility, always with patient respect for his individual needs. WOFRE adds to the exact scientific mind and spiritual soul part of the methodology, non-judgment, unconditional acceptance, and support for the client. The question now, when we are familiar with the skeleton of the system, its pillars and bases, is where is the magic of the methodology? Beside of the interconnection of more fields, why should it work? And the magic of my universal methodology lies in practice, training, and precisely defined, supervised, facilitated, and evaluated steps, which need the close cooperation and relationship with the client, who needs to understand his responsibility over his own life quality, because everyday training in the form of step-by-step task diaries for each day for the entire duration of the program are an integral part of my universe methodology. Photographs are a genial tool for new brain circuits formation because goal-oriented objectification empowers the process of learning and retranscription. This graph represents the overall summary of steps how my universe methodology systematically works and mainly what are the effects when it is used appropriately. That means facilitated part of program is fully attended and exercises and practice are responsibly fully done. Using gold and defined visual and walking meditation, we continuously train the mind to wide and deep true perception and train the switching of the brain towards regular being mode during the everyday normal life. During each task, exercise, meditation leads to slowing to delta waves. In these steps, or in this stage, the phase of using photography evoked self-other relations mindfulness come to the game, and we work with unconscious patterns during the first third or first half of each program, because it is really difficult or practically impossible to build happy mind when unconscious patterns are hidden. After the first third or half of the program, we use the defined combination of therapeutic mindful photography and PESORM in combination with art of seeing and conscious imagination to redirect the old neuropath phase and to build new neuropath phase in a positive way. I have already implemented my universe methodology in a group of healthy women outside of the hospital via the pilot 10-week program. In this group, 2 out of 20 women reported untreated anxiety, 1 had depression treated with medication, others reported a variety of reasons when they decided to complete the program, from finding meaning and direction to I don't feel happy in my family, work, and so on. This pilot program is evaluated by NETI questionnaire, which is scientifically recognized questionnaire. Pilot results of program for women have shown that program improves aspects of inner satisfaction, acceptance, gratitude, ease, identity, the self, vision of subjective reality, and others. Program also decreases worry or discomfort about past or future, or the feeling of fear or anxiety that inhibits my action. The woman with depression started to sleep better from the halfway of the program. She continued in the real training which she learned during the program, and now 4 months after the end of program she is free of any antidepressant medication. I am aware that this is a valid pilot program. I see it as a seed that was seeded and it needs to be further well looked after. I ideally plan and work on introduction of the methodology to hospitals in a specific groups of patients and to further develop, validate and evaluate it. I would like to validate the methodology and its potential effects on changes in brain neuroplasticity via adipokines and other neuropeptides and neuroendocrine markers levels and by imaging methods. As a clinical scientist, I had been working with patients with eating disorders for almost 10 years. However, I felt that the tools and the type of the research I have been doing is not enough. That the roots of these group of illnesses are more complex and rather neurodevelopmental and psychosocial. As the statistics for recovery from anorexia are horrifying, based on American Journal of Child and Adolescent Psychiatry, up to 1/3 die from complications of the illness, 1/3 remain chronically ill for the rest of their lives, and only the remaining third maintain some form of stable recovery. The call for some kind of other approach is alarming. Birds of Mine is standardly 20-week program for eating disorders, which uses my universe methodology to work with self-kindness, self-acceptance, self-compassion, body image, identity, self-perception, self-control, and personal life story in eating disorders. The main pillars of Birds of Mine program are my universe methodology basis, as described earlier in this presentation, and specifically modified for eating disorders, Bofre approach, and work with positive brain neuroplasticity. In the case of eating disorders, standardly 1/4 of the whole 20-week program creates working with body image perception via specifically modified Bofre approach. However, sometimes the ratio between my universe methodology and Bofre approach during the program varies individually for the benefit of the client. The main aspects we work with on step-by-step via pictures, photographs, visual perception during Birds of Mine program are love, control, identity, neurobiological and psychosocial development. We are searching via the methodology for a kind of brain switching, a click, redirection of paths that were organized somewhere during developmental and growing process and manifested later on. As Elizabeth Hook said in her TEDx Chicago speech, I believe that eating disorders truly reflect a desperate desire and failure to meet essential human needs. And I believe that these needs are what we need to understand in order to help people suffering through these illnesses. Tasks during the whole Birds of Mind program are not about eating and food, because the illness itself is not primarily about eating and food. Much more important task is how to find identity when mind is blinded by eating disorder, and what was the starter of the disorder, what leads to awakening of sleeping developmental pathology, and can pictures help to find the way out? And how to find control over the mind lost in the ball of neurodevelopmental and psychosocial playground with unclear rules? Can we take control over the mind via reframing of the self-picture? Last year's positive effect of classical mindfulness in treatment of eating disorders has been proven. However, what is the effect of changing mental perception via visual mindfulness and pictorial objectification is unknown. I think that to study the potential of mental objectification via photographs on brain neuroplasticity and neuroendocrinological setting is a great call for future research, and I hope that my universe methodology could be one day recognized as valuable complementary therapy for patients with eating disorders, which has a proven effect in searching for causality of eating disorders and improving patients' quality of life. Photography and science should no longer be seen as two. There is photographic science in every photographic process, and there is a strong potential and place for photography as a tool in scientific research. If you are interested in my universe methodology development and would like to stay in touch and connection, you can follow general public web pages covering the activities or follow us on Instagram. Thank you for your attention.